So welcome to this webinar on intersectional approaches to support student mental health. As you're probably aware, this is the second of two webinars. We held the first one last Thursday, and the first one also focused on different projects. So we've got a whole different set of projects to talk to you today about. We are recording both of these webinars, and so they'll be available on our website. We're uploading both at the same time later this week. So do take a look at the first one. If you weren't able to attend that, it will be on our website shortly. And next slide, please. So just some housekeeping. Closed captions are available. Please click on the CC icon towards the bottom of your screen. Like I've said, please be aware this webinar is being recorded. When you would like to ask a question, please use the Q&A box rather than the chat box. If you would like to talk to a member of the team, the events team, then please use the chat box if there's any kind of technical issues. But any questions for our projects today, please do use the Q&A box. And do feel free to put questions in throughout the presentations as they kind of come to you, and we'll pick them all up at the end. Okay, next slide, please. So a quick run through of the agenda. So I will start with a quick introduction on the OfS, our work on student mental health, and how the mental health funding competition we are sharing today was developed. We'll then hear from London South Bank University, who will share their experiences of designing and implementing interventions for Black students. Next, we will hear from ACM Guildford, who will share their peer mentoring programme. And then St Mary's University will present on their intervention designed for first in family and students without family support. And finally, the University of Bristol will share their project focused on supporting autistic students. Each presentation will last around 7 minutes to allow plenty of time for question and answers at the end of the session. And so with the questions, if you would like to ask a question of a particular speaker, please include their name or their project name at the start of your question, just to make it a bit easier for when I'm directing them. And project leads have kindly agreed for their contact details to be shared. So if any of the audience members wanted to follow up on anything, or you had any questions that weren't covered in the Q&A, you will be welcome to reach out to them individually. And it's towards the end, near final slide, that we've got those contact details for you. Next slide, please. So as I've said, I'll begin with a short introduction to the OfS and our role in relation to student mental health. We're aware that many attendees will have attended both this webinar and the webinar last Thursday, so there'll be a little bit of repetition for the next couple of slides, but then we'll be straight on to the projects. Next slide, please. Brill. So this is kind of a short summary slide on the OfS's approach to student mental health. So individual institutions are responsible for developing their own mental health policies and procedures, and we don't currently have a specific condition of registration on student mental health. We want to encourage providers to develop their own approaches to improvements in this area, understanding their unique context and the needs of their students. This includes ensuring a whole institution approach, having policies in place to support students, encouraging environments where students feel comfortable to declare mental health conditions, and centering the needs of students through co-creation. So we do have some specific functions within the broader welfare and safeguarding sphere, including under the public sector equality duty, specifically on advancing equality of opportunity. You will see how we've used our funding competitions to encourage providers in this way. And next slide, please. So there's several tools at the OfS's disposal to help a programme for championing a safe, healthy and inclusive higher education sector for all students. You'll see on this wheel kind of the different tools we have at our disposal, and I'll kind of touch on a couple of examples now. So through funding, we fund projects to develop innovative solutions to tackle poor mental health among students. For example, the Mental Health Challenge competition and the Mental Health Funding competition. In access and participation plans, our regulatory advice encourages providers to consider the risk of equality to equality of opportunity due to mental health. And it is included in a sector-wide risk in our recently published Equality of Opportunity Risk Register. We have also recently published updates to Regulatory Advice 6 and Regulatory Notice 1, which are related to access and participation plans, and they give more information on how providers should consider and address gaps in outcomes for students with a declared mental health condition as a disability. On the data and evidence side, we publish access and participation data sets to encourage providers to take a targeted approach to addressing inequality gaps. We also publish data on student characteristics to understand population, outcomes, and associations between groups of students, which includes data on students with a declared mental health condition. This year, the National Student Survey, the NSS, includes a question on mental well-being. We've shared some of that knowledge that's come through in the data and evidence in our insight brief, which I'll talk about in a second. We also fund external projects to develop and support sector-wide effective practice. An example of this is the What Works project, run by a consortium of organisations and led by TASO. The main outcome of this project is the publication of a digital repository of what works in different contexts for supporting student mental health. Additionally, we are funding action learning sets, which have facilitated discussions between HE providers and NHS providers to understand challenges and work together on opportunities and solutions. We work with a range of partners and cross-sector groups to bring together providers, charities, and government departments. We have also funded sector-level guidance, such as part funding the development of the University Mental Health Charter, led by Student Minds, and the Suicide Safer Universities guidance, developed by Universities UK and Papyrus. We respond to concerns and complaints at a system level to ensure the sector is responsive. And finally, underpinning all of this ongoing work to understand the barriers for groups of students accessing mental health support. In 2019, as part of our data work that I've mentioned, the OfS published an insight brief on student mental health. The brief included intersectional analysis on the access and participation data, which revealed some stark findings on gaps in outcomes for particular groups of students with declared mental health conditions. Following on from this analysis, the funding programme was developed to address some of the gaps identified. Next slide, please, Dawn. So the Mental Health Funding competition was launched in 2021 with investment from Department for Education and Department for Health and Social Care. 18 projects were awarded funding, creating a broad portfolio of work with interventions targeting different groups of students at a range of providers. In the bidding guidance, the OfS outlined 2 key priorities. So projects should target particular groups of students with characteristics identified as increasing the risk of poor mental health, or groups of students who might experience barriers to accessing support due to their course, mode of study, or other characteristics. Next slide, please. So the projects began in August 2021. In December 2022, the independent evaluators Wavehill, who were one of our presenters at the webinar last week, if you are interested in hearing from them, they published a report on programme findings related to student co-creation activities in phase 1 of the programme. Activities are currently evaluating, the projects are currently evaluating their interventions and summarising findings for these to be published in a final programme level evaluation report by Wavehill in early 2024. We're really pleased to have the opportunity to hear from some of the projects today who have kindly agreed to share their experiences and some of their findings. For further information and details on all of the projects and the students they are supporting, please head to our website. Next slide, please. So first to present, I would like to welcome Andy and Luke from London South Bank University to share their experiences on supporting Black students. Over to you two.
Hi, everyone. I'm going to try and get through this as quickly as I can. My name is Andy Owusu. I'm the project lead for the Proactive and Preventative Interventions Project, otherwise known as the Black Students Mental Health Project here at LSBU. So a quick summary, the project works with our Black students to identify and remove barriers to help seeking, and through co-creation to create culturally relevant resources for our students to build trust in our service and develop a community that changes the narrative of mental health within the Black community. Next slide, please. So in terms of the approach that we took, so the first step that we did was to recruit a project officer with a genuine occupational requirement, so a Black LSBU graduate, myself. And the purpose of this was to direct this project. So to have a project that is targeted to a specific group, is best to have that sort of voice in it in terms of from the management aspect of things. And it's been great to be able to engage with our students, and I'm pretty, this helps quite a lot. So next thing, sort of the approach that we did was to establish a physical presence on campus by popping into classrooms, lectures, seminars, open days, libraries, all the busy student dense areas, sort of to engage with students in person and advertise the project directly to them, and allow for the students to see who's behind the project and who sort of be emailing them later on. And so in my experience, this increases the likelihood of students actually responding to digital outreach later on. The next thing we did was co-creation. So with the direction of sort of developing the preventative materials for their peers regarding mental health, through co-creation, we developed a list of resources that are used as proactive and preventive materials and tools that aid well-being with our students. And of course, students were always paid for their contributions to the project. Another aspect is the merchandising and incentives. So sort of using uniform and branding to sort of develop a community around the project. So simple things like shirts and hoodies and the offer of payment help to remove barriers to participation, which I'll go into a bit more later on. And this helped to sort of really build the community and start the project off the ground. Next thing was to recruit other students. So using like snowball sampling. So establishing these relationships with our students, offering sort of enriching and engaging events, created promoters around the project. And it's made it a lot easier to communicate with our students around campus and within their little subgroups, WhatsApp group chats, etc. So one of the main ways in which we sort of spread the message of our projects around campus. Next slide, please. So in terms of the learning, that representation is important at all levels. I know the impact that I have had on our students at this institution just by being in post. The relationship developed through the project as it connects to our student services, helps to build trust within the service, which means that our students are more likely to use the service or to explore the co-created material that we have developed. Also have a representation of a Black individual starts to increase some of our Black students' sense of belonging here at the institution when they see the diversity of staff. An additional point is the sort of financial support and impact of engagement in terms of giving students the opportunity to be fairly compensated for their contribution. We paid over hundreds of hours to our students for their contribution to develop these our service and develop our resources, allowing us to connect a student voice. Otherwise, for students who otherwise would be sort of harder to reach, that we all have within our institutions, the offer of payment to help to remove some of those barriers really helped us to bring those voices to the forefront of the project and lead it. And of course, it's like how generally interested, what we learned, how generally interested people were to collaborate and develop their own services here at the university. So it's cultivated this culture of co-creation and open dialogue about well-being. There's been various contributions from a vast range of students, and we learned that representation is important at all levels. And the financial support impacts the engagement, and of course, learn how generally interested people are to contribute to sort of the development of their own institution and their own services, and how much they value their input and how proud they are to see the results of their input make an actual change within the institution. So whether that is through our materials they see on campus, or through our services, or through our delivery and the systems that we use here at the university. Next slide, please. So some of the key learnings will be, for me, the value of intersectionality to our students. So every student has a different, multiple layers of identity, right? So as a Black student, you could be international, you could be a member of the LGBTQ+ community as well. And make sure that we have a service that sort of caters for multiple levels of a student's identity was one of our main things, to provide a more holistic, student-centered approach. Next thing is the input of academics. So this is something that's already being done by some of our academics. We want to encourage it more. So there's a lot of work being currently done by student services, academics as well. We've done a cultural competency training that we did within the student services, and we're looking to roll that out wide. I know from being within wellbeing team that some of our academics are really on the ball, and they make referrals to our colleagues that sort of make them smile because of how comprehensive these and detailed these referrals are. And we want to really put those guys on a pedestal and to be able to shout and sort of use those examples to build on the relationships. Another thing is the language and understanding. So the language used to describe mental health and the services and what we offer and what mental health means to the students varies, right? So language is used by the institution. Sometimes and sort of definitions and descriptions of mental health may be understood differently as what is intended. In my own experience as a West African, some cultures, mental health is seen as an indication of things like witchcraft, for example. So you can imagine what it may mean to a student when you approach them talking about mental health, maybe indicating or insinuating that they may need support with mental health. So being really able to put those things in perspective and understanding the language and the student's perspective of their understanding of the word mental health or anything pertaining to that. And of course, the additional understanding of services. So they show that the understanding of service of what we offer can vary in terms of from our students' perspective. And the additional variance of the perception of accessing service can sort of negatively impact the students' academic journey. Some students, especially when it comes to like international students, maybe some of them even have the perception that they may impact their visa status, etc. So really being able to understand the language around what we use, the language that we use, and how we describe our service, and how our students understand it as well. Next slide, please. So in terms of what our next steps are, so it's just a quick summary of what we've done so far. We've developed a huge community here at LSBU, and we've embedded a lot of activities that sort of strengthen these changes that we're trying to make. We've developed a great template for co-creation that we're going to be using throughout our other student services as well. And we've developed relationships with partners, both externally and internally, to put this together and to create something that is comprehensive and is actually making visible change here at the university so far. We've created a content list spanning over 30+ topics. And we have our partners with NHS Good Thinking and U+, on multiple platforms that increases the accessibility to our content for our students. And of course, in terms of what's next is the action plan. So developing an action plan put in place by student services and overseen by the head of wellbeing, Luke, who is here as well today, if he wants to add a couple of words. Just looking at some of the sustainability elements of the project and making commitments to co-creation and expansion of the resources, and of course, peer support schemes that we put in place in conjunction with different departments such as the SU. Yeah, that's pretty much it. Luke, if you want to add anything else into what the action plan will.
No, that's great, Andy. I think we're moving on to the next presentation, but obviously we can talk about the action plan, the question and answers afterwards. Thanks very much, Andy.
All right, that's it from me then. Thank you very much. I'll hand over back to you, Emma.
Brilliant. Thanks, Andy. And Luke, and like we say, time for questions at the end. So do feel free to send any questions you have now for Andy and Luke. So I'll move us straight on to Lynn from ACM Guildford, who will be sharing about the peer mentoring project that ACM Guildford's been leading.
Thank you. Can we have the slide? Thanks very much. Yes, so we called it Many Hands Project. We had many partners, rightly or wrongly, and we were focusing on a cross-partner peer mentoring programme. Next slide, please. So we had 7 independent higher education providers, ACM the lead partner, and we were supported by 2 commercial partners, Applied Inspiration, our fabulous evaluation consultants, and the Ambassador platform, who provided the tech, and Independent Higher Education, who are the independent sector membership body. Next slide, please. We signed up to do quite a lot and ended doing a bit more as well. So really the second bullet is the focus. So doing something really what we thought was quite exciting, getting a single pool of mentors from across 7 partners, many of whom are very small numbers of students, which increased the pool of people and the diversity of people, diversity of lived experience for students to connect with. And this was the very first project of its kind in terms of number of partners and working in collaboration in the sector, so quite exciting. We looked at creative, mature and BME students and intersectionality. And we use technology in various ways to match, to attract and match mentees to mentors, and also to facilitate our collaboration and working. We ended up doing something new, which was, or wasn't planned, which was working with Birmingham Mind, just as Andy was talking about, to increase confidence and literacy amongst tutors. So that we've developed a training programme there. And we are producing 2 reports, some info on that at the end, around working with the NHS and third-party providers, and also the benefits of collaboration. Next slide, please. So I've got 3 key things to share. This project was so rich, there's so much to tell, and there's a lot of practical information along the lines that Andy was talking about, which we're putting together in 2 webinars, and again, information at the end on that, but just really wanting to hover above and see as a sector what we felt were the benefits for us and for our students. So again, you know, first time a single independent specialist had led a partnership of this level, working with commercial partners and the membership body as well. And it really demonstrated for us the power of participation. You know, colleagues who didn't even know they existed, mentoring each other as part of the process, joining each other's boards. So, you know, obviously sharing and increasing knowledge and resources within and across the partners. So some of the partners have multiple sites. So there was feedback that communications and knowledge development had increased amongst us, you know, within our organisations, never mind with the other partners, and evidence that the collaboration had increased strategic approaches to mental health and wellbeing. Again, not always seen to being as strategic in approach as other providers. There's been real progress there. And creating sustainable, some fabulous connections that we know are going to continue, because one of the exciting things about the project is the legacy. So IHE are going to be leading on opening up what we've done to the wider IHE membership. We will be looking to continue the mentoring programme and increasing access to that, possibly being managed by an external third-party provider, but also to develop mentoring based on a similar model for staff. Really, we feel that it sort of highlighted our ability as a sector of small specialists to connect and understand with our students, who are, again, as Andy said, they're individuals, they often have complex needs. And I was pleased to see, you know, one of the great things about this project overall is that we've all shared amongst the projects our findings, and there's lots of commonalities there. So this student-centred approach. And we feel that tutors and student services staff can really get to know the students in our places and build the trust that's essential to understanding what's going on for them and referring to appropriate interventions like peer mentoring as a new initiative that has seen some impact for some students. The mentees, obviously, but not least the mentors, who have created a fantastic community, and it's such a valued offer for them. It's been life-changing for them as well. And just about target groups, so, you know, what emerged was the categories are so broad, and the challenges that we thought we'd find aren't always or necessarily present. So, you know, you've got a small provider like Matrix School of Counselling and Psychotherapy in rural east of England, mostly women, mostly 20s, 30s, 40s, not many of them working necessarily, dealing with very different issues to mature students at Regent College in London. Most of them were working from Uganda, from Ukraine, dealing with all the complexities that studying in London has to offer. So huge variety there. And again, with the creatives, you've got performers, you've got music business students, and then you've got people who are designing games and music for games. And so again, it was very interesting to think about how to engage these students and what was going to work for them. And we've got loads of stuff to share on that in our other webinars. Yes, we think that our students prefer not to be grouped, to you know, preferring the fluidity and identity and finding commonalities themselves in lived experience. And also because of the legacy work, we've done some consultations. So our members are saying, IHE members are saying that, you know, they don't necessarily want narrow groups either. So future programmes will be open to all students, but of course designed with risks to equality of opportunity in mind. Final slide, please. So we have 2 webinars which will be available to our members, IHE's members, and no doubt beyond. We're just trying to create those at the moment to tell you, how we did what we did and what we learned, and how to set up a project so that you can avoid the pitfalls and reinventing the wheel. And there'll be 2 reports which will be available on our website again to all in the next couple of months about the power of collaborating and how to collaborate with us as a sector, as well as the one on working with local NHS, some case studies there about what works, why it doesn't work, that sort of thing. And my contact details are there in case anybody wants to get in touch beyond today.
That's great. Thank you, Lynn. And thank you for kind of setting out what your reports will cover as well. I'm sure everyone will be kind of waiting for those and looking forward to kind of, like you say, hearing your advice for avoiding pitfalls and also kind of celebrating the successes as well. So looking forward to those. Thank you. So I'm going to keep us moving on. I'm going to keep a bit of pace up to give us enough time for questions at the end. So moving swiftly on to Nikki from St Mary's University in Twickenham, focused on their project aimed at supporting first-in-family students and students without family support.
Hi, everybody. I'm assuming you can hear me fine. So thank you for joining the webinar. I am Nikki Anguilleri, and my role is Head of Widening Participation across the student life cycle at St Mary's University in Twickenham. And although she hasn't turned her screen on yet, I'm joined by Livia Scott. Oh, here she comes. So I'm joined by Liv, who was a student researcher on our project and is now a research assistant at Maudsley Learning from the South London and Maudsley NHS Foundation Trust. So we're here to represent the Mind the Gaps project team, which was a collaboration between St Mary's, Maudsley Learning, King's College London and University of West London. So 3 universities of very different sizes and student demographic populations, all with different institutional setups as well, and our specialist mental health provider, which was Maudsley Learning. In the webinar today, we're going to share our experience of the project to date, and also talk a little bit about how we see it continuing to expand as we reach the end of this project phase and embed it into our working practices at each of the universities. Next slide, please. So as a quick background to the project, our project was focused on supporting students who were studying higher education without the types of familial support that most students, or typically students, would take for granted. So we targeted first in family students, estranged students, care leavers, international students, and some mature students. So those students who either had no family support or came from families without direct experience of higher education themselves or the British higher education system. And so we were looking at how we could support them to manage their well-being during different transition points in their university journey. So the types of students that we were looking at had limited family support, and the research that we conducted previously suggested that they're at increased risk of poor mental health, social isolation and non-continuation as they make their way through these transition points in their careers. And the transition points that we identified as well included entering and leaving university, moving between academic years, and some of those semester breaks, particularly the long semester breaks, where students might experience additional challenges around academic pressures, financial pressures, relationships, negotiating the contrast between their out of university life and their in university life, homesickness, loneliness, isolation, and all of those other aspects of student life. By exploring personal skills and experiences in this context within a group of peers, we propose that students can feel more confident to manage the hurdles and to navigate those transitions during their university time, whilst also building those all-important connections with other students. And so as such, our project aimed to deliver a psychoeducation intervention to address the challenges and give students the opportunity to work collaboratively to work through those challenges and to find solutions for themselves, with the ultimate goal of improving their well-being, their belonging, and their confidence. Liv, slide 3.
Thank you. So our programme was delivered in 2 main phases. Firstly, we engaged in an in-depth co-production exercise with a group of 18 student collaborators who we recruited for the project. And this involved an initial needs analysis through a set of focus groups and meetings to understand the sort of wellbeing challenges that they experienced, followed by co-production of the programme activities, which included continuous feedback and piloting of the programme content to gather sort of student preferences for the programme structure, and a general student training session to support them in co-delivering the programme. And then the second phase involved delivering the psychoeducation intervention, which comprised of 4 live face-to-face workshops and an online resource package sort of throughout the academic year. Next slide, please. So the psychoeducation intervention was delivered in workshop and online resource formats to allow for a sort of big flexibility in access, which was a particular need highlighted during the co-production stage and in conversation with our students. The programme followed 4 key themes shown in this cycle here, with each session building on skills from the other, although these could also be accessed independently as a one-off session should students choose. So this took students through a journey of identifying their experiences and personal wellbeing needs at the beginning of the year, developing skills to manage their time and work-life balance to meet university demands, reflecting on the journey so far, and learning problem-solving skills after the sort of first assessment period in the academic year, and finally refining the skills that they'd learned throughout the year to plan ahead for the future. Next slide, please. So in terms of what we found, the evaluation findings are currently under analysis for the final report, but we wanted to share some really cool key messages so far. So firstly, and perhaps unsurprisingly, evaluation was a challenging undertaking due to the varied successes in student engagement at different stages of the programme and the varied ways that the students access the sessions, particularly where they may not have accessed all of them. Overall, we had 119 students from the 3 institutions express their initial interest in the programme, and 80 unique students participating in some way, with some participating in multiple sessions or modalities. And students shared a strong sense of satisfaction with the activities, with the majority agreeing or somewhat agreeing that they had learned something in the session and the information was useful to them as students. Most importantly, students valued having an open space for discussions with other students about their well-being and challenges, and identified lots of different activities that they would want to practice beyond the session to support themselves. Next slide, please.
So the project has been an incredible opportunity for us to learn about cross-collaboration between some very different institutions, and most particularly with our students. We could speak at length about some of the challenges, I'm sure you all could, but also some of the successes from this project. But in the interest of time, we've just picked 4 to highlight. Firstly, both of the phases of the project benefited from continuous student outreach to facilitate engagement. As with other projects in this OfS funding competition, student engagement was a challenge, but we were able to gain good buy-in from those who we regularly communicated to in a personalised way. Secondly, our project trialled a broad range of engagement approaches, and we learned that there was no one-size-fits-all across all institutions. Sharing through university newsletters, social media, and direct student-to-student communication were all useful in different places. So for a variety of methods are required for all students to get maximum traction. Thirdly, our initial design had big, maybe too big, idealistic dreams for what we're going to cover in the programme, which we soon learned were not feasible. So the value of co-creation was absolutely essential for this. The co-production phase told us student preferences for the programmes, which were ultimately to keep things simple, short, flexibly accessible, and opportunities to interact with other students ideally with the provision of food. And finally, throughout the project, we were able to share learning across the project team. This was the strength of our collaboration, and it allowed us for improved understanding of different HEI contexts and simultaneously trial and error the approaches in different locations. And our final slide. Next steps. As our project team works to finalise the current delivery of the project, we're all very enthusiastic about seeing how it continues to grow and benefit a wider student group next year onwards. Over the next few months and the next academic year, we'll be identifying ways to expand the reach of the project beyond our institutions, to continue to deliver the programme to a new student cohort and to embed it with what we're already doing within our institutions, as well as gather further evaluation data to develop the programme, and finally identify other opportunities to continue sharing and growing the programme. That's it. Thank you.
Brilliant. Thank you, Nikki, and also Olivia or Liv, I'm not quite sure. It was really interesting, and I'm sure we'll be getting lots of questions about your lessons learned. They were really interesting kind of snippets, but I'm sure people would like to unpick those further. So thank you very much. And absolutely, if anybody does want, you can post your questions now, and we'll pick them up at the end. So do feel free to post them throughout the presentations. So we're moving now on to our final presentation, last but not least, welcoming Emma and Felicity from the University of Bristol to share their project, designing, delivering and evaluating the first autistic mental health training programme for university staff in the UK. Over to you, Emma and Felicity.
Okay, so mental health conditions are much more prevalent for autistic people than they are for non-autistic neurotypical folks. And some work that Felicity was involved in previously showed that one of the barriers for autistic students specifically is a lack of knowledge on the part of university staff. So we have developed some training to address that lack of knowledge and hopefully make it easier for students to reach out and get the support that they need. If I could get the next slide, please. So in order to do this, we recruited an advisory group made up of representatives from the National Autistic Society and Spectrum First, which is an autism training group, pardon me, as well as autistic students from each of our participating universities. These guys were involved right from the beginning, even before I was part of the project. Some of them were actually involved in hiring me as a research associate, and they are the ones who really chose the direction of this training. They created a list of topics and important points that they wanted the training to cover, and I basically just had to come in and put that list in order. It was very straightforward for me. They also reviewed the training at various different stages. So they looked at the initial plans for the training. They looked at our lecture slides before we had recorded anything, and they got to see the final version with all of the resources attached. And of course, they could make changes throughout that period. We also had our students take part in panel interviews where they talked about their own experiences as it related to each of the topics. These were recorded and shown as part of the training, so staff got to hear from the students themselves. That wasn't the end of their participation, especially for our students. We really wanted them to get the most out of being part of this group and to get as much experience as possible. So they have come with us to international conferences where we presented the project, and they are also working with us on a research article that we're producing at the moment. If I could get the next slide, please. So the training course itself was originally online. It looked at debunking stereotypes that staff might have. It looked at autistic mental health specifically compared to non-autistic. And we also discussed some practical strategies for how to make interactions with autistic students as easy as possible for those students. It's been completed by about 120 staff members across those 3 universities, and we've done a few different versions at this stage. So the very first version was about 10 hours worth of content delivered over 5 weeks. That was done over the summer break last year. We then adapted it to just an afternoon session, a 3-hour course delivered over Microsoft Teams. We then took that short course and are now delivering it in person within the School of Engineering at the University of Bristol. Just in the last kind of couple of weeks, even since I put these slides together, we've been approved for a new version of the training, which is going to be made available on the kind of University of Bristol staff training platform. This is called Develop. It's just a kind of click-through version of the training that staff can do independently. That has been made available now and is kind of accessible for all student-facing members of staff at the University of Bristol, which is significantly more than 120 staff, so that's a little bit intimidating. If I could get the next slide, please. So we're now in kind of the evaluation part of our project. We started off with some pre and post-training questionnaires. These looked at staff knowledge and any stigma that they might have around autism. And we wanted to see whether or not there were any differences before and after the training. Unfortunately, we found no significant differences, but the trainees that we had were already really engaged. They all volunteered for this training, and some of them were already quite knowledgeable. Some of them were even members of disability services staff, so they'd already interacted with a lot of autistic students. So their kind of pre-training scores were already pretty high, so that might be why we didn't see much difference. We also ran some interviews with trainees, got some very positive feedback, which is very nice. Even those staff who already knew quite a lot still felt like they learned things on this course. They learned specifically about the university context, about autistic mental health, which are things that weren't covered by previous training. And they really appreciated having that student voice, kind of hearing from the students was really beneficial for them. They were also already talking about the strategies they were going to use and how they were going to change up their practice, which was really, really great to hear. We followed up with staff over the next academic year. We had them filling out diary entries where they talked about their interactions with autistic students, what was helpful from the course, what wasn't. We had a little bit of trouble with uptake for that, so we then switched to a survey format that was sent out every month. Still had a little bit of trouble with uptake, and the kind of responses that we were getting were quite limited. We were getting a lot of yes, no, not applicable type answers. So following on from the OfS meeting that happened a few months ago and some advice we got there, we've now edited the questions on that survey, added a few prompts, listed out the strategies and asked staff to identify which ones were useful. So fingers crossed the most recent versions will be quite helpful. If I could get the next slide, please. So our next steps are to run some interviews with the students to see if they've noticed a difference in their interactions with staff. We want to make the training available more widely. Of course, the Develop version is part of that. And myself and Felicity are going to be running a neurodiversity in higher education conference that will be happening in September this year. That's going to bring together people from this project as well as other researchers and practitioners in the field. So if you want to know anything more about that, please feel free to ask. If I could get the next slide. Yes, so thank you very much to the OfS for running this webinar and funding the project. And yeah, thank you to our advisory group, to the National Autistic Society and Spectrum First. And thank you all for listening.
Right, thank you, Emma. And your project is just so interesting on a group that is so frequently not focused on. So again, I'm sure there's going to be lots of questions on your work with specifically with autistic students. So that concludes the presentations from the projects. Thank you to everyone who's presented and for all the interesting work that you're doing to support student mental health. So we have a good amount of time. We have about 25 minutes now for Q&A. So do feel free to post your questions. As I mentioned at the start, there's two boxes. There's the chat box and the Q&A box. Could I ask you to post questions in the Q&A box and anything on kind of technical or anything you want to talk to the events team in the chat box? Again, if you would like to ask a question of a particular speaker, please include their name or project name at the start of the question so we can direct it, and we'll try and get through as many questions as possible. I suppose I might start with Bristol actually, just because that's what we've just finished on. So Emma, you mentioned that you are able to make the training available to all staff in student-facing roles going forward. You touched a little bit on about the evaluation as well, and I'm wondering whether you're able to, whether you're looking to do any evaluation once you kind of have it with a wider group. Who you talked about, you were with a very engaged group, and there may be, I suppose, other findings now that you're kind of broadening out the offer.
Yes, we are still running the same evaluation. So we're also including that pre and post questionnaire with our online training. Yeah, I believe there's also kind of some feedback kind of questions included in that post, so we can hear back in a little bit more detail from the develop trainees.
Yeah, brilliant. And a question we've had in, was there anything unexpected that you heard from students when creating the training that you think would be helpful for others to know?
I think in that regard, it's kind of understanding how much people's needs can vary. There's kind of an assumption that all autistic people are pretty much the same and will have the same level of need, and that's very much not the case. Some people might need more academic support, some people might need more social, mental health support. So I think it's really important to kind of discuss, particularly if you're meeting with students one-on-one, to really ask them about their needs and not kind of assume that you would know because you've done, like, even if you've done our training, to kind of assume that you know everything.
Well, I'm gonna start jumping around now to some of the different projects. So Andy and Luke as well. Andy, you've had some positive feedback on the presentation. Someone said, great presentation, Andy, and great impact by connecting with the Good Thinking app. We are also planning to promote this app. Will you be continuing to work with the Good Thinking development team?
I'll pass that one over to Luke.
Thanks, Andy. Yeah, yes, we will. That's absolutely part of our sustainability action plan. In there is to both update our resources in there and also create new resources in there. So the co-creation of our Black students creating resources for our students and indeed beyond on the Good Thinking app is absolutely central to one of our action plans. There's kind of 4 or 5 priorities in there, but that continuing with that relationship is central to it. Yes.
Great, thank you. And another question for Andy and Luke. Do you have any recommendations for others when producing culturally competent mental health resources? It's quite a big question.
Yeah, it's a big question. I guess the approach of co-creation, having the student voices, most of the other, if not all of the other projects I've mentioned, is that it has to be sort of student-led. There's no point of an institution creating a resource and throwing it at the students if it's not at all relevant to them in any way, shape, or form. And of course, speaking to that is something that Luke is going to be taking forward, is the sustainability of it, keeping the content refreshed and relevant to the cohorts that are coming in and out of the institution. Because as the times change, the needs will change, and the reflection of the demographics will also change, and student needs will change overall. So it's just something to have a system in place that keeps that that train sort of going, to keep that co-creation going. But yeah, co-creation will be the main thing. Student voice leading the way. But the students will let you know what they want. When we started our project, we had no idea where it's going to go. Through our conversations with our students, with workshops, interviews, focus groups, and surveys, they sort of let us know exactly where the gaps were and what they needed additional support on. And that's where we went and filled those gaps with our students through co-creation. So they led the way through the projects from start to finish.
Mm-hmm. And so I suppose moving from working with different students, Lynn, we have a question for you on challenges or successes that you could share of your experience of working with lots of different partners on your project. I can't hear Lynn, so I might just say,
there we go.
There we go.
Thanks, Andy. Just saying that, you know, when I was an independent consultant coming to run this for ACM, and I was sort of thinking, this isn't going to work. How are we going to manage this? They're like, you know, partners all over the country. They've never met each other. I've never, you know, and doing it a lot of it virtually, obviously, as we all were. But I think we had the right people. So top tip is pick the right partners. You know, they are absolutely superb. Lots of different specialisms. So Matrix College of Counselling and Psychotherapy developed the mentor training and associated materials, so that we had the best there. You know, safeguarding was at the heart of that as a result. Our students at SAE Institute in Liverpool designed the website, supported by the Vice Principal of Future Works in Manchester, who happens to be able to do these kinds of things. You know, there was a real kind of rolling up of sleeves and thinking, right, who's the best person to do this? And I just think as well, you know, saying the obvious, that you need somebody in a central sort of pivotal role who will hold it all together. I mean, you know, it's managing multiple partners, getting people to do things. You know, you've got to pull a lot of levers, and I think sort of just trying to make sure that everybody sees what value is coming out of it to keep people engaged. Well, and the final thing is having top-down buy-in, obviously. So we had some very, you know, at each partner we had the strategic leads, but also had, you know, safeguarded people, student services experts, and developed different communities within the steering group to work on specific aspects of the project. So, you know, I think those are the kind of key things. There'll be lots more in the report on collaboration.
Yeah, because I think you've obviously had a lot of partners to work with just in this project, but you mentioned in your presentation that you're looking to widen the collaboration across the IHE membership. Is that kind of mapped out yet? Will you be taking similar approaches, or have you got a plan?
I think that's why we're looking at paying a company who would do the management. I should have said that Future Works in Manchester, Kate and Leanne in the student services, who are the student services team, managed the whole programme. They were the ones who dealt with the applications from the mentors and mentees, the matching, the paperwork. They did that on top of their already very busy jobs. That just isn't sustainable for them as a team. It wouldn't be for any of us. So if IHE offers it as a product, as part of a membership benefit, then it's something that could be funded. So that's how we're thinking of it, trying to think cleverly of how we can keep that offer there, but make sure that it is sustained.
Yeah. Thanks, Lynn. We're getting a few questions in about, unsurprisingly, student engagement, student co-creation. So a question for Nikki and Olivia. In your presentation, you talked about having 80 unique students engaged out of 119 expressing interest, which to me sounds like quite a high conversion rate. Do you have any kind of advice or reflections on what might have supported you on having such a high conversion rate?
I think those figures are slightly, we had 18 co-creator students. They were the collaborator students. We had 119 students who engaged overall with 80 conversions. So what we learned was that it was not a one size fits all, that what worked at St Mary's didn't work at King's, what worked at West London didn't work at St Mary's. And so it was really about knowing your own student population and actually working in the way that they operate. We found that face-to-face contact, we had some really proactive student collaborators and some students who currently work for us as well, who literally went around, you know, speaking to students at St Mary's. That worked incredibly well for us, but the same thing didn't work at all at some of our partner universities. So whereas they had newsletter call outs, which worked much better there. So, you know, I would say it's about finding your own students. It's about trying a range of different things and then going with the ones that fit your particular context. And the co-creators as well. I mean, the co-creators were incredible and were invaluable throughout the whole thing, from beginning right through to end. And we will also be using our co-creators ongoing next year as well. Our co-creators were paid for their time and because they were doing a job of work for us. So they were paid, but we definitely got much more out of them than the money that we paid for them.
Yeah. Thanks, Nikki. A similar question to Andy and Luke. Could you tell us a bit more about the peer mentoring program for Black students? Have you had successful engagement with that program, and any key learnings to share?
Yeah, of course. So with the program itself, what we wanted to do was to create a network of students who are well versed in signposting and familiar with the service that we offered here at the university, and of course to create a community of students that support each other. It's quite as simple as that. In terms of sort of the engagement, we had really good engagement. We set up a space of 40 spaces as we put in our bid, so 20 mentors, 20 mentees. We put the advert out and we had to shut it down within like 2 days, to be fair. So once we put it out, we had over 90 towards 100 sort of applicants, and then it became a problem of what we do with the rest of these guys who've also shown interest. So there were some sort of processes to be able to get the students who would need to be mentored in the mentee positions who would benefit from that. So these are students who are maybe repeating the year, students who may have any additional supports as well. So there were processes that we worked with our SU, who are our key partner to delivering this, because they're more student facing. They were the actual deliverers of the peer mentoring program. So yeah, once we sort of got our students established within their roles, we went out, we got an accredited training program to make sure that our students actually had a tangible sort of certificate with them when they left, in terms of on top of like sort of upskilling them with the intangible skills that they'll get through mentoring and being mentored. We wanted to give them more practical skills and something that they can put in their CV as well, and something they can take on into the real world and outside of university life as well. And like having that done, they had to go through a sort of an intensive training program over a period of days before they could get those qualifications as well. Had the mentoring program going for as long as it did, and then at the end of it, having sort of the successes fed back to us. We chose 2 or 3 students sort of keep tabs on to do like a case study, sort of study them as they're going through, look at the confidence levels of engagement with their mentor mentees, and how those skills evolved over time. But overall, when we looked at the cohort of the group, it was 100% of the students said they found the mentoring program beneficial. 100% of them wanted the program to continue. They didn't want it to come to an end, which is great things to take forward. And as Luke will speak to that, we've also put sort of a system in place where we're going to be taking that forward. That's one of the sustainable elements of the project, and that's something that developed over like within this funding group, right? And Luke, I don't know if you want to speak about what the elements are going forward.
Yeah, great. Thanks for that, Andy. We did this, as Andy says, in conjunction with the SU. So there's a Black Student network within the SU, and we kind of gave them the project. I mean, gave them that aspect of the project. But the key thing was we worked really closely with them in supporting the training of the mentors. So there's some external training of the mentors, but equally a lot done from my team in wellbeing advice and supporting them to make sure that they're doing this in a safe space and they're feeling confident when they were working with the students. And that was a key aspect of our involvement in it. We found that, I mean, I think institutions have peer mentoring schemes across, but sometimes in school areas, sometimes in hall areas, sometimes as part of the SU. And I think we've learned a lot from this in terms of students, what they spoke about their shared life experience that came through the peer mentoring scheme, because this wasn't focused at all on the academic side of things. And we're running this out now in our residential settings and our hall settings. We're running a peer support scheme, a peer mentoring scheme that's directly come as a result of the work that came out of this project. So it was a really positive thing for us. I mean, I think from our point of view, we are trying to work with the SU and trying to make it sustainable through the Black Student Network. That has its own internal challenges when we're working with the SU to continue momentum going. But across the institution, we're looking to translate some of the findings of this across. So it was a really positive aspect of it. And our project report focuses quite a lot of that and of the impact of it.
Right, thanks Luke and Andy, and also we have some of your students produced from us some really interesting videos about their experience of co-creation, so they're on the OfS website as well, and it's just lovely to hear directly from students as well about their experiences of participating in the project, but also that, as we talk about, co-design, co-create.
That's right, Emma. And I think when we're disseminating, we're doing a lot of dissemination work around our projects at the moment, a lot of sharing things. Those videos speak better for the project than Andy and I could and stuff, or certainly than I could in terms of it stuff. So I would encourage anyone to have a look at them because they show the real impact there. Yeah.
Thank you. So again, on a similar theme for Emma and Felicity, we've had quite a few questions in this area, so we've kind of combined it into one. Again, people sending a lot of thanks for sharing information about your project. Question is, how did you identify and recruit your co-creation students? And then a slightly separate thing, and I'm very interested in the conference, would it be possible to share the details?
I will lead the first question to Felicity.
Yeah. So in terms of recruiting the students before the project had even started, a couple of them were students from those universities who I had worked with before on research projects, or who had got in touch with me independently to say that they were interested in contributing to research, kind of in addition to their studies with us. And then we also sent out adverts for students who might be interested in taking part at each university, and then kind of spoke to the people who got in touch with us and you know, told them a bit more about the level of commitment and things like that, and yeah, ended up with 4 or 5 people who contributed across the 3 universities.
And another question, given the low numbers, this might not, you might not be able to share this, but someone's asked about, can you give any more information about the demographics of the autistic students in terms of gender identity?
Of the students who helped us create the study?
It doesn't specify, so I think any, basically, either contribution or participation, or even more broadly than that.
Yeah, so we don't have any students who've done the interviews yet, so we don't have any demographics data on them. Of our 5 autistic contributors, 3 are female, 1 is male, and 1 is non-binary, I believe. So that's our gender breakdown. They are all white, but they come from very different parts of the country and different socioeconomic backgrounds.
Great, and just sticking with Emma and Felicity for one more question. Did any of the students share experiences of wider services within the university, such as accommodation and academic development?
Yes, very much so. Emma, do you want to speak a bit more about that?
Yeah, I guess we both probably had similar kind of interactions with students about that. I know I've spoken to our neurodiversity society about this issue as well. We did have members of staff from those services taking part in the training as well. So we've had quite a lot of kind of interaction with accommodation, careers, disability, other kind of academic supports. And I think our students generally found those kind of systems very difficult to navigate, I think is really the key there. I think for autistic people, being able to kind of access those, understand the right pathways and feeling confident in reaching out is a really big issue. And so really the goal for our training was getting kind of personal tutors and staff who work, like academic staff who work with the students, more comfortable with what's available and what supports are available to help students with that access. Because I think that was really a big talking point for us. I don't know if Felicity has anything to add to that.
Yeah, I think students were very willing to share both their positive and negative experiences with wider services. Some would have really good experiences, particularly with disability support services, but they found wider support services more tricky. For example, trying to access things like counselling or mental health support, because at most of the universities we were working with, those things are separate to the disability support. And so that was one of the big things that was talked about by students in terms of joining up those kinds of systems.
Thanks. And just to pick up on the second part of an earlier question about the conference, do you have any more information you can share about that?
Yes, so the call for abstracts is now closed, so we're no longer accepting any submissions for people who would be presenting, but the conference itself will be happening. I don't actually have it to hand. I believe it's the 15th of September. It's a free conference to attend. It'll be happening in Bristol. We'll be releasing information on how to get tickets and everything probably in the next couple of weeks. But yeah, if anybody wants or is interested in getting more information about that, then they can feel free to contact me. That's fine.
Well, thanks, Emma. Thanks, Felicity. So final question on the kind of student engagement, and this is for Lynn. So how did you encourage participation in mentoring with students who are potentially already becoming withdrawn due to mental health challenges?
Mentoring, or engage them as mentors or as mentees? Mentees?
Let's start with mentees.
Yeah, I mean, Nikki said it all really. It was just, you know, we had 4 iterations of our, and Andy said it as well, of our marketing materials, or, you know, revising our strategy. We just thought we would put the fabulous profiles of our fabulous mentors up on the website, and the applications would come flooding in, and they didn't. And it was, you know, it was thank goodness lots of other people, as Nikki said, had the same experience. We had printed materials everywhere. We had the emails, you know, students don't read emails, you know, it just visiting the clubs and societies. And again, as Nikki said, everybody's different. All your partners are different. What works one place doesn't with the other. But the messaging really helped, because we changed from, have you got stuff going on, in a very warm, supportive way, you know, do you need an ear, through to being more specific and linked with the student calendar. So what happens with the student as they go through from freshers to first exams, and then they've got no money in January, so we're trying to be more direct if you've got worries about money. And then we ended up with you know, for the beginning of the next financial academic year, saying, you know, be the best you, find a buddy to be brilliant this year. And, you know, and it's sort of like, it's just so hard to gauge what worked each place with, you know, and then with different partners. But what we listened to the mentors who were saying, this isn't working, there's too much paperwork, you know, we adapted all the time. We changed the model to be much more fleet of foot, because it was taking too long once we got a hold of a mentee, getting them through, so they were disengaging. They just want, when they want help, they want it now. They want an ear now. So we learned so much about that, which is what's going to be in the webinar to help people not go through, you know, what we went through, sort of thing. So, but the nub of it is, and you've just missed Tanya, I think she's gone from Region. It's grabbing the students, knowing the students, and having that personal relationship with them where you can. And some of the bigger places, I imagine, can't, you know, but that's one of the things that we found that we could. You just know, you know, you bring up some Tanya and say, what, you know, what's happening with Kushama, and she's, oh yeah, well, she's on holiday this week and she's got 6,000 students, she's got them, you know. So it's just that personal approach and understanding, you know, as Andy said, the student-centered approach to it really, to that engagement, the individuality, the complexity, and what's best for them. And it gets over some of the stuff around stigma and, you know, confidence from the mentee's perspective. And the language is so important. They don't really know what peer mentoring is. You know, that's what we found. So it's why we ended up saying you have a buddy, you know. But, you know, so it's about explaining, and you can do that on a one-to-one. This is what it's about, you know, don't worry about it.
Nikki has a hand up. I think she might have something related.
Yeah, it was also just the same point about language, really. We found students reporting kind of well-being initiative fatigue. And I think, you know, with the whole COVID thing and all of the publicity around young people and well-being and so on, and students reporting that, you know, it's just another slightly performative thing that we were doing, and so actually we moved away from well-being language as well, and the message sort of, if it's about mental health, then say it's about mental health. If it's about actually other things, then say it's about other things. But well-being didn't really cut it with them at all. So actually making sure that you've got the language that actually matches what your students want and what your project is about. So our project was not about mental health as such, and so it was about, you know, learning to cope strategies. So actually well-being didn't really say it.
Yeah, I think that's I'm going to stop there, that we've got quite a few more questions, but we're running out of time. I think that's just a really important point to end on, in terms of obviously students are the people you're trying to engage with, you're trying to support, and it's really about understanding their needs in terms of language and things that make sense to us as kind of more policy people, the people who've designed these things, might not make any sense to the users. So yeah, I think really eloquently said by Lynn and Nikki, thank you. So like I say, we've unfortunately not been able to get to all of the questions today, but our presenters have kindly agreed to share their contact details, which, yes, they're just up on the screen now. So please do get in touch with them directly if you have any further questions about their projects. As I mentioned at the start of the webinar, we will be sharing recordings of both webinars towards the end of this week. I think it's popped up in the chat somewhere, the link of where those webinars can be found. But if you sign up to the OFS alerts on our website, you will also get a notification when these are published, and link to them as well. And if you would like to contact the OFS team regarding our work on student mental health, we'll be sharing the email address at the end of the presentation and in the chat. So again, if you want to get in touch with us about anything, please do get in touch with us. So finally, after the event has ended, we will circulate an evaluation survey, which will cover both this webinar and the webinar we held on Thursday. So if you attended both, you'd only need to complete one survey. We thought people would appreciate the reduction in paperwork. So we'd really welcome any feedback on this event. You know, this is quite different in the post-pandemic world, way of us kind of sharing and celebrating the successes of the projects that we funded. And we really want to kind of know how that's helpful for other organisations, other providers in the sector as well. So I just want to take a moment to thank our presenters once again, Nikki and Olivia, Felicity and Emma, Andy and Luke and Lynn as well. Thank you very much for your time today. It's much appreciated. And thank you everyone for attending. Bye-bye.